Kick back, let's talk science, huh? So today we're going to talk about sauna use and the impact it has on cardiovascular disease. The reason we're going to focus on this topic specifically is because it happens to be this area of research that we know most about as far as saunas and the impact it has on health. And the reason we know so much about it is because of this huge study that was done in eastern Finland, where the researchers took a group of people living in Finland and divided them into different groups depending on how often they were going into the sauna and how much time they spent within the sauna. The first study that was published in 2015 was just men, so it was over 2,000 men, and they divided them into if they sauna one time versus 2 to 3 times versus 4 or more times per week. And also grouped them into when they go in the sauna, how long are they in the sauna, and grouped them into less than 11 minutes per session, from 11 to 19 minutes per session, and then greater than 19 minutes per session. And they screened them for frequency, and then they followed them over a period of time. In this case, they followed them for on average of 21 years, and then looked at all-cause mortality. So what that means is a death from any sort of chronic disease, a non-accidental death, so not something like a car accident, but instead something like cancer, cardiovascular disease. And they looked even deeper into the all-cause mortality and saw cardiovascular death specifically. So any sort of death from cardiovascular disease. And they went back into the data to see what is happening with people who sauna more frequently or for a longer duration of time, and the impact it has on their overall cardiovascular health and all-cause mortality. And they found incredible results. So there is a dose-response relationship, it's called, where an increased frequency resulted in a decreased risk of death from any disease, specifically cardiovascular disease, and then also an increased amount of time resulted in an additional decrease in risk. So people who saunaed more than 4 times had a significantly lower risk of any sort of cardiovascular condition than somebody who saunas just once per week. And again, they're comparing people that sauna once to people that sauna more than 4. You'd expect that these results would be even more significant if you're comparing it to somebody who is not sauning at all. And then also, if you sauna for less than 11 minutes, you're not getting as much benefit as the participants who were in the sauna for more than 19 minutes. And also the group from 11 to 19 minutes was seeing additional benefits compared to less than 11. So we have this dose-response relationship. More sauna, less death. And this was only done in men in this particular study. What they did then is at their first follow-up point. So in these, what are called prospective cohort studies, where they take these populations and divide them into different groups and then monitor them over time, they do these different checkpoints where they'll check in and assess, are these groups still following based on the groupings they were in? Are they still in the sauna? If not, what's going on? And have they died of different diseases? So they have these different checkpoints. And at the first checkpoint, they did add a female group to this study as well. That paper came out later in 2018, where they added females to the results. And the results still hold true. I mean, males, females, they're still getting that dose-response relationship where more sauna, less risk of death. Okay, so this is all great, but what happens when we actually look into, well, what's going on? Why are we getting this added cardiovascular benefit? And as it turns out, saunas are having a similar effect on our physiology as exercise does. So if you hopped on a treadmill, you'd see this increase in blood pressure, this increase in cardiac output, which is your heart's ability to pump out a certain amount of blood. So your body has to maintain a certain cardiac output. And cardiac output is stroke volume multiplied by heart rate. Heart rate is just, the metric you get on your activity watch of how often your heart is beating in a given minute, in beats per minute. And then stroke volume is each one of those heartbeats, how much blood is the heart pumping out? And if you multiply those together, you get cardiac output. Now, as we exercise, our muscles demand quite a bit of blood flow, so we have to increase that cardiac output. So you'll see stroke volume go up, you'll see heart rate go up, you'll see blood pressure go up. You'll also dilate the blood vessels to your skin and try to lose excess heat as sweat. And so we see that with exercise, we also see that with sauna. And this is what's called an acute stress. So a temporary stressor on our cardiovascular system that forces it to adapt so that next time we have that level of stress, it's not as difficult for our cardiovascular system. So it's going to become better equipped at pumping blood. So we'll see our stroke volume start to increase with more exercise or with more sauna. And what happens when our stroke volume increases, so now our heart's so good at pumping out blood, our heart rate doesn't have to stay quite as high to maintain that cardiac output. And so that's why you see people who are more conditioned tend to have lower resting heart rates. That's because their heart's just better at pumping blood. This is an adaptation to those acute stressors. You also see blood pressure start to drop because your blood vessels are so compliant. They're able to dilate to certain areas when we're exercising, like open up to deliver blood flow to the muscle, constrict to different areas when we're exercising, like our internal organs. And your blood vessels just become so much better equipped at distributing blood throughout your body. And so you'll see blood pressure drop over time as an adaptation. So this happens with exercise, we know. Well, it turns out it also happens with sauna utilization. So this paper here, they took individuals who were at risk of coronary heart disease, and they stratified risk by if they had elevated blood pressure, cholesterol levels, diabetes, or if they were current smokers, because we know that impacts cardiovascular function. And they had them go through a sauna, an infrared sauna in this case, for 15 minutes each day for 2 weeks. And they looked at what's called flow-mediated dilation. So I talked about when you exercise or when you sauna, your blood vessels become really good at opening up and constricting, delivering blood flow where it needs to go. Well, if you occlude a blood vessel, so to measure flow-mediated dilation, what they do is they put a blood pressure cuff on and they inflate the pressure of that cuff so that you're not getting blood flow to your distal forearm. And they keep that blood vessel occluded or closed off so that that blood can't flow. Now, the muscles and the blood vessels in the distal forearm are going to sense like the drop in blood flow, so they're going to have less oxygen. They're going to need to open up to try to get more blood, but we've occluded that blood vessel so they can't. Now, as soon as you deflate that cuff, blood's going to rush out because it's all backed up in that area, and it's going to increase the size of the arteries there because of what's called shear stress. So that increase in blood volume is going to open up those arteries. And we want that to happen so we can deliver more blood to this area that was just occluded. And turns out people who have, this cardiovascular issue, high blood pressure, high cholesterol, and poor arterial compliance or scar tissue that's causing these arteries to be stiff, they're not able to open up their arteries as much. And so when you measure what's called flow-mediated dilation, where you'll take a baseline diameter, and you use an ultrasound assessment for this, where you can actually look at how wide is a particular blood vessel, and then you increase that blood flow and see how wide does it get to. And you'll take the difference of that, of a baseline diameter of a blood vessel, and then how much it opens up to. And that's flow-mediated dilation, and people that have poor blood vessel responses have lower flow-mediated dilation numbers. And what the authors or the researchers in this paper found is that sauna use was able to improve flow-mediated dilation in these individuals who are already at risk of some sort of coronary artery disease. So it has an effect on our blood vessel responses as well. We don't just see this benefit when we're looking at people who are already at risk of cardiovascular disease, but we see it with healthy participants as well. And this is a much more recent study with over 100 individuals where they looked at arterial compliance. So how well can your blood vessels respond to this increase in blood flow? And again, having a higher compliance in the arteries is going to be indicative of a healthier cardiovascular system. And one of the ways they can measure this is using what's called ventricular ejection time, where in your heart, you've got your left ventricle that's pumping blood to the rest of the body. And you measure the time that it takes to pump that blood. Having a larger ejection time is indicative of a stiff artery that the ventricle has to work against. So if we can drop ventricular ejection time, then that's going to be a good thing. And what they did in this paper is looked at just one sauna protocol, measured blood pressure, both diastolic and systolic, and mean arterial pressure, and then this ejection time, and found that just one bout of 30 minutes in the sauna had an improved ability or these participants' ability to respond was improved. So their cardiovascular function was improved. And this is specific to the arteries. So we know, okay, there's this impact it's having on the heart, this impact it's having on the blood vessels. And in addition to that, this is a pretty cool study that was done using sauna with participants that were going through some sort of exercise protocol, and they broke them up into endurance training and strength training or a combination, and then provided saunas afterwards. And the sauna had an impact on total blood volume, or plasma volume in this case. And that increase in plasma volume after the sauna sustained over time. So they measured it before, after, and then after 24 hours, so the next day. And they found that there was this increase in plasma volume, and the participants in the study sustained that. Now, having an increase in plasma volume is contributing to total blood volume. So you're getting more blood just simply from hopping in the sauna. And this is what we see with exercise too. We increase blood volume. When you have an increase in blood volume, that's going to contribute to this stroke volume that I talked about earlier, where your heart's ability to pump. So your heart has what's called the Frank-Starling mechanism. Frank Starling discovered this way back when. Don't know who this guy is, but essentially he found that the heart's able to beat on its own if you pump blood into it. So as the heart opens up to receive blood, the muscle cells within that blood become so stretched out, and there's this elastic component to them, and they contract to restore back to that resting position. And so when you have this increase in volume, you have an increase in what's called preload, or increase in the load on the heart as it relaxes and receives that blood, and then it's going to pump it back out. Okay, so you have this increase in stroke volume because of that added blood volume. And so you're getting all these benefits to your heart, your blood vessels, to really essentially your overall cardiovascular function. And with cardiovascular disease being the #1 indicator of death, or not indicator of death, #1 cause of death globally, now we've got this tool that if you utilize saunas, you're improving your cardiovascular health. I mean, that's going to be huge for the general population, and definitely something that might be worth looking into. Obviously, anytime we're talking about a protocol like this, you're going to want to discuss those things with your physician and make sure that you're able to handle the increase in body temperature, increase in cardiac output that occurs in a sauna. So always consult your physician beforehand, but I mean, these results are pretty darn impressive.